You're watching the News Hour.
It is World Mosquito Day, a day to raise awareness about the causes of malaria, how it can be prevented, and fundraising for research into its cure. A country manager, Nigeria, Corporate Alliance on Malaria in Africa, Ochuko Kiyamo, joins us now to discuss this matter. Good to have you here on the News Hour.
Thank you for having me here.
Yeah, so from what you understand, the World Mosquito Day is to mark a British doctor, that's Sir Roland Ross's discovery in 1897 that female mosquitoes transmit malaria between humans.
Yeah.
But how much is really known about female mosquitoes and the causes that they give to man?
Okay, thank you once again for having me here. We appreciate this day. World Mosquito Day is a very significant day in public health and global health in general. And mosquito is, I would say, is one of the most deadliest animal in the world. And it transmits a lot of diseases, including malaria, yellow fever, dengue, chikungunya, Zika, and elephantiasis, which is called lymphatic filariasis. And so it's a very deadly animal, but people are not a lot of people are not aware of it, and that's why I'm here right now to talk about it. The government, the private sector, and critical stakeholders in all over the world are actually moving for creating awareness around this, and that is one of the reasons why I'm here as well, to create awareness, to let Nigerians know of how deadly this disease is and what we can do to prevent it moving forward.
All right, as significant as this day is, so far this day has been, celebrated yearly.
Yeah.
Do you see the world winning the war or the fight against the mosquitoes?
Definitely, yes. There is hope. The fight has been on. We call it an Asian fall. The fight has been on, and we have different governments in different parts of the world that has done a lot in malaria elimination. We have in the Americas, malaria has been eliminated. We have in some part of Europe. And in Africa right now, which bears like 90% of the burden of malaria in the world, we are still in the fight. But the government and, like I said, the private sector and critical stakeholders are all rallying together to see what can be done.
Are they doing enough?
I would say a lot is going into it right now, but not enough. We have a lot of challenges, including funding gaps at the international and at the local level. We need more investment in malaria. We need more research to be done as to get more tools in coverage, in treatment and diagnosis, and so we can get it to the end users. We need access to commodities, more increased access to more of these commodities like diagnosis and treatment, and those are the rural areas, especially. They lack some of these useful tools that are needed to actually combat the disease. So as soon as we can get all this in place, I'm sure the fight against malaria will be won. And we also need an integrated vector control management in our part of the world. In addition to using of bed nets, long-lasting insecticidal bed nets, we need to start the implementation of insecticidal residual spray, which is called IRS. So a combination of all these factors, I'm sure, will get us to where we want to get to, and it is feasible to eliminate malaria.
Now, some scientists are talking about the possibility of getting rid of these mosquitoes, trying to mutate them more or less so they don't become harmful to humans. How possible is that? Do you think it's ever possible to have mosquitoes that are less harmful to man so we can, have a better world where no one gets to be afraid of being infected of malaria?
Yeah. As we all know, or maybe people are not aware, we have different types of mosquitoes. The carriers are actually the female Anopheles mosquito.
Right.
And so if we can reduce the population of the female mosquito or get them eradicated completely, we will be in a better world. We will be more healthier. We will be safer. Less of our children would die. Less pregnant women would die. And so that is why I talked about increasing and a need to increase investment in research. We need to put a lot in that area. And so what researchers are trying to do right now to genetically modify the gene and see if we can have less prevalence or of the female side of the mosquito is feasible, actually. But we need to invest more. Invest at a local level, invest in research institutes in Nigeria, we have a lot of them doing a lot, but they need more money pumped in that direction to ensure that we get our results.
Earlier you talked about the dangers and the fact that people do not really know that mosquitoes are responsible for dengue, Zika, and the likes.
Yeah.
But then, there's so much effort being put in place to curb the spread of malaria. Are we really communicating these dangers, putting so much effort as well at communicating how dangerous these mosquitoes can be, especially at the rural level? We are, the governments, we're working as a Corporate Alliance on Malaria in Africa. We're working with the governments, working with other stakeholders in development sector to ensure that these messages are out there. We try to do it in English languages because Nigeria is different demographics and different cultural and geographical landscape. We're trying to get the messages out there in different languages. So those are the grassroots who also get the message, and that's what we call BCC, communication messages at these levels. And in Africa in general, we're working with the UN, we're working with WHO, rollback malaria and other critical partners to ensure that the message about malaria is really getting to the grassroots and those that really need it.
Well, finally, before I let you go, to the common man out there, what is your message to them to help stop, the spread of malaria?
Okay, first off, malaria is very deadly. It kills about 200 million. We have about 200 million cases annually globally. We have about 445 million deaths annually. In Nigeria alone, we have about 24% of that cases is as a result is due to malaria in Nigeria, and 25% of that number is also beared or borne by Nigerians. And so I would say that as a people, we need to ensure that first off, if not all cases of fever are malaria, not all cases of
quickly,
whatever.
You need to wrap up your message because we're running out of time.
So first off, when you have a fever or symptoms, get tested, get treated with the right treatment, stop self-medication, sleep under bed nets, and clean your environment, which is very important.
We must leave it here now. Country Manager, Nigeria Corporate Alliance on Malaria in Africa, Ochuko Kiyamo, thanks for your time on the news.
Thank you.